Hey, Dr. Lipari at Jacksonville Center for Reproductive Medicine. It's exciting to be able to talk to you guys about this series we've been doing on in vitro fertilization and pre-implantation genetic testing. Take a look at the previous videos. We've kind of gotten to the point where we've got the embryo, we've done the biopsy, who should do it, who shouldn't, should we even do it at all? Does it hurt the embryo? These you guys can find in the previous videos. But pre-implantation genetic testing, we found that several people are opposed to it because the question is, how effective is it? No test is 100% certain. And I wanted to kind of go through with you guys some of the things that we think about when we do the biopsies. Basically, when we do the biopsy on the embryo, again, we're taking a sample of cells from the outer portion of the embryo. And many people feel that the outer portion of the embryo does not always reflect the chromosomal makeup of the part that becomes the baby. So are we truly getting a picture of the chromosomal component of the baby itself? So that's kind of hard to say. The other thing that we know is that sometimes many people feel that an embryo may have the ability to self-correct, meaning if there is a chromosomal problem, can that embryo somehow continue to develop in a normal way? And no one really has the ability to kind of tell us that, right? But what we do know is there were earlier studies done where embryos were biopsied on day 2 or 3 and called abnormal. And then on day 5, they were retested. And some of those that we called abnormal were actually normal. So is it that the embryologist was selecting the one cell that was abnormal and took it from the embryo, or did the embryo correct itself? I think these are really important things to think about. In our next series, we're going to talk about something known as mosaicism, which is another factor involved that can cause a discrepancy with the pre-implantation genetic testing results.